A very good evening to my team members from Dr. Reddy's group for providing me this wonderful opportunity to speak about some important topic today evening. Today evening, I myself, Dr. Anirban Sadhu, MD MRCP, head of the department, Gitara Multi-Speciality Hospital, Department of Medicine. I will be discussing about the effect of NSAIDs, that is non-steroidal anti-inflammatory drugs, and their impact on the gastrointestinal system or health. As we all know, NSAIDs or non-steroidal anti-inflammatory drugs are a mainstay of treatment in pain management and reducing pain and inflammation. They are perhaps one of the most common group of over-the-counter drugs sold across the globe. Medications like ibuprofen, naproxen, aspirin are widely used for conditions such as arthritis, gastric pain, menstrual cramps, headaches, back pain, knee joint pain, and various other issues. However, their effectiveness poses a potential cost along with various GI side effects. This is the topic of tonight's discussion. So, understanding the mechanism. First of all, we should understand how they affect these NSAIDs, how they work. The NSAIDs mainly work by inhibiting the enzyme cyclooxygenase or the COX-1, which acts on in production of thromboxanes, prostaglandins, and prostacyclins. So they are particularly COX-1 inhibitors, which plays a crucial role in prostaglandin production and prostacyclins. Now, these prostaglandins are very much important in various physiological processes, including fever, pain, inflammation, pain perception, and the protection of the gastric mucosa or the stomach lining. The NSAIDs primarily inhibit the COX-1 enzyme found in the stomach lining, particularly along the parietal cells, and responsible for producing prostaglandins, which help on the stomach's protective barrier against gastric stomach acid. So, inhibition of the COX enzyme has various complications. That means the complications of NSAID use on long-term basis or on various painful conditions. The disruption of the protective prostaglandin production can lead to various GI complications, as such peptic ulcers, which are a breach in the mucosal membrane causing a painful sores that develop on the inner lining of the stomach or the duodenum, and NSAIDs have significant risk factor for peptic ulcer development, especially in high doses or with prolonged use. Apart from local irritant action on the gastric mucosa, they damages the prostaglandin production and causes hyperacidity, acting as a secretagogue, and hypermotility affects the motility of the stomach also, which further enhances the chances of developing peptic ulcers. Then gastritis. Erosive gastritis or inflammatory gastritis as found in the stomach lining, edematous condition with painful cramps causing dyspeptic symptoms like indigestion, nausea, and heartburns are very much common in long-term use of NSAIDs. GI bleeding. Long-term use of NSAIDs can increase the bleeding chances from the stomach or intestinal wall by causing ulcers or perforations, which can manifest as bloody stools or melena or blackish stools, giving the occult blood test positive inside the if stool is analyzed. Also, various other factors like indigestion, dyspepsia, erosive gastritis, and recently gastroesophageal reflux disease. These have been associated with the long-term use of NSAIDs. Now, what are the risk factors? There are certain risk factors which can increase the risk of GI complications from NSAIDs. Older adults' age are more susceptible due to decline in the lining of the stomach's protective barrier mechanism, and various comorbidities like underlying hiatus hernia or GI bleeding or irregular eating habits, underlying medical complications like pre-existing peptic ulcers. These together contribute to development of the GI complications of long-term use of NSAIDs. And concomitant medications when used along with NSAIDs such as steroids, corticosteroids, or anticoagulants can further increase the risk of bleeding. So definitely NSAIDs are of great value in various painful and inflammatory conditions, but their use should be limited wisely or whenever used should be supervised by an expert opinion. What we can do for minimizing the GI risk with NSAIDs? There are several strategies which we can help to minimize the GI risk associated with NSAIDs. Using the lowest effective NSAID dose to start with, then titrate the dose according to the physiological need and the demand of the body, which can be tolerated. Taking NSAIDs along with food, that means postprandial after food, considering alternative medications like selective COX-2 inhibitor, the newer generation of anti-inflammatory drugs, whenever are used, or which drugs which acts on the central pain receptors, thus sparing the gastric mucosa and the gastric barrier system, or using of proton pump inhibitors like omeprazole, esomeprazole, pantoprazole, rabiprazole, whenever to protect the gastric mucosa from the different damages as already discussed previously from the harmful effects of NSAIDs. So, coming to the conclusion, NSAIDs are valuable medication for pain management and inflammation. Despite their crucial role, awareness regarding the potential side effect on the GI tract and their knowledge and proper dosing is very much important. Consulting a healthcare professional can help to determine the best approach for managing pain or to minimize the risk of GI complications of NSAID use. Now, coming to some common clinical scenarios, apart from these, the NSAID use have different also side effects on the gut microbiota, which can causes the various metabolic effects on the body's digestive system. Apart from the attacking the gastric mucosal barrier, if NSAIDs are used for a long time, they disturb the residing gastric flora or gut flora and suppresses their beneficial action on digestion and thereby causes various dyspeptic symptoms. So when NSAIDs are used, if used along with a proper proton pump inhibitor, as we know, most of them are heat and drug drugs. That means the proton pump, whenever once blocked, they get blocked for almost up to 18 to more than 24. Thus, a single dosing is enough to suppress the extra acidity or the disturbance of the gut microbiota caused by NSAIDs. So thus, they can be prevented. The side effect of NSAIDs when they have to be used, aspirin in various cardiac conditions or various cerebrovascular conditions like post-stroke patient or post-severe cases whenever they have to be used at all. Also, as we discussed previously, wisely choosing NSAID like a selective COX-2 inhibitors which spares the gastric mucosa, it can be of various utility, and the proper dosing and knowledge before prescribing is very much important, and a healthcare professional who is qualified should be always consulted before starting any sort of NSAIDs, because apart from damage, small damage like gastritis or ulcerations or dyspeptic symptoms, they can cause serious symptoms like GI bleeding or severe form like hematemesis and melena. We have commonly seen find in clinical practice these issues. Also, the hypermotility, these NSAIDs have the secretagogue actions which stimulated the CCK-PK enzymes and causes hyperstimulation and hyperacidity, which causes increased movement of the gastric symptom. So this hampers the absorption of essential nutrients from the food substances, which get bypassed quickly or passed quickly throughout the GI luminal tract and get excreted to feces in undigested condition. So long-term use of insects can give up to some certain malnutrition, particularly in absorption of trace and microelements, and deplete the body from calcium, magnesium, and decrease the bone density and affect the various endocrine system and reproductive and growth system of the body. So the use of insects should be limited very cautiously to be used if along or should be used along with a proper PPI to have nullify these effects. So this was all for tonight's discussion. I would again thank all my team members from Dr. Reddy's group for providing this wonderful opportunity to discussing about this topic. And I hope in near future we shall be further hosting such topics in GIST. Thank you.